Hello, my name is Cheol. I'm a licensed acupuncturist. Today we're going to discuss about the lung cancer. People so much interesting about this subject because of nowadays a lot of people who live in this world and in these days they are suffering a lot of lung cancer. Their family, their friends, their relatives. And this subject is everybody really like an interesting subject, which means they really wanted to know how to, treat for the lung cancer. And before that, I'm gonna tell about the statistics. As I know, about the 19th century, about 100 years ago, the rate of the cancer. I'm talking about the cancer rate. People who have a cancer rate is 1 out of 30, roughly I remember, which means it's kind of rare. But nowadays, in these days, maybe 1 out of 3 or 4, maybe even 1 out of 2, which means, one over two people, they got cancer. How serious is that? Cancer is a very difficult subject. Very dangerous subject, very scary subject because of, people who have a cancer, they think, oh, I'm gonna die and I cannot live in this world not that long. So everybody's scared, okay? So today, and I'm gonna talking about the natural way of how we can treat for the cancer, and then how the Oriental medicine look for how treating for the cancer or lung cancer. So that's a very interesting subject. But besides for that, and I also mentioned about the cancer patient have to be more natural way is very good. But after I discuss for the subject of the Oriental way of how to treating, and then I'm gonna tell more about the natural way about the treating how to do. Any kind of disease like diabetes, blood pressure, like cancer, we don't say we can cure, but we definitely make a symptom better. So don't misunderstand. But maintain control is very important. Okay, but we don't say we can cure. Some people say cure. No. But we are even better because of you have to maintain control. The result is automatically good result you're going to have for that. So we always have a diet, exercise, how you can be confronting about the serious subject of disease. Okay, so don't get afraid even you got the cancer. So I'm going to explain the Oriental way how we do. The Oriental way, the ancient time, in deficiency. Okay, I'm going to translate with the English. This means near. In deficiency causing issue the producing heat issue plus heat. Okay, so what does it mean for this is human being have to have a balance, yin and yang balance. This is a yin, this is a yang. Yin is the most cold kind, okay, and also essential fluid like a hormone, this is all yin. So this is a more like a cold characteristic, and this is a more like a hot characteristic, heat, and this is a cold. Okay, this is a yin, this is a yang. Okay, so why they have a yin depleting deficiency? Well, stress, well, the processed food, junk food. You have to have a responsibility what you having your daily life, daily what you take. You have to be very careful. You have to be smart. You have to be good because of if you have a drug, if you have a smoking, if you have any bad stuff, junk food, you're gonna end up very severe, kind of a disease like this. Okay, so issue is the one of this. Okay, people too much nervous, too much anxiety, too much worry and junk food, and then yin goes down. When yin goes down, they don't have ability to have a balance, and it producing automatically heat remain. So the heat is not the strong heat, like a mild heat, but continuously bothering. People have like a face kind of red and feel like a thirsty and mouth dryness, and then the hand foot like slightly wet, and when you wake up and sweating, this is all the sign of insufficiency like that. So we have the medication, 백합 고금탕, one of the name of the herbal medication. But we have good herbs, and then like Pinyin say about 생지, 맥동, 현삼, and 천하분. All this kind of this kind of things, even 옥죽, it's good for that. So if you're living like too much stress out and too much junk food, that's the leading to the insufficiency, causing the one of a bad influence to have the lung cancer. And another thing is spleen deficiency. Spleen deficiency is Cheol. Cheol means deficiency, and producing dampness. Well, our organ spleen is so much like involved chi energy and blood producing. So when spleen function is not strong enough, and then unnecessary damage is causing like this, and then people have the bowel movement is very loose bowel movement, and then the food tasting is not too good, who are swallowing is not too good, and indigestion, everything is like this. So people want this kind of things, and we have a 육군자탕. We're using for that, and this is one of the good herbs to make a very vital sign to spleen organ. And another thing is chi and blood is a stagnation. So chi, blood, stagnated. What does it mean for this? People, there is some reason, too much anxiety, or junk food, or some other drug they're using too much. Like drug means not even the bad drug, but even people too much Western drug. Whenever sick, they go to the doctor to have a Western drug. Western drug is good for the temporary symptomatic treatment, but as I know, all kind of drug is acidic and make a not too good influence to our human body. So this is a chi and blood stagnated. So then we're using the tohong samultang. This medication, this the herbal natural medication, has a lot of good influence for the blood circulation, blood stagnation, get rid of a blood stagnation. Another thing is heat toxin produce. Heat toxin produce. What does it mean for that? The unfavorable heat constantly increasing in human body, that causing ultimately producing some kind of toxication. What is that? Like smoking and drinking too much, and drug, and and lots of stress and anger, and so many bad stuff daily life. It's producing like this. So we get rid of the heat, and toxin is good. And another thing is chi and blood deficiency. What does it mean? Chi, energy, blood. Stagnancy is a very deficiency. When people have a chi and blood deficiency, their daily life is very, very tough, very tired, like a chronic syndrome, like chronic fatigue syndrome, like and then the face is pale, and whenever daily life is so much tired, even even take a rest, oh, I feel so much not comfortable, I want to lie down and take a nap, or even that feel tiredness, this kind of things, all these kind of things influence to the lung cancer. Okay, this is a lung cancer, the one of not even lung cancer, a lot of things, but the people who got the lung cancer, this kind of lifestyle causing the lung cancer, you have to be very careful. Okay, so another thing is kidney yang shu. Okay, what does it mean kidney? Kidney function, yang function is low. Then people have a coldness, hand, the leg, feet, and limbs, they feel like cold, and body feel chilly feeling, and they got easily catching cold. This is the immune so much low there. So let's say about yin deficiency and spleen deficiency, qi and blood stagnation, heat toxin, qi and blood deficiency, kidney yang deficiency. When this kind of condition, this is a not good balance, okay, human being. No matter what this, you go to the check by the Western doctor, blood test, oh, they say, you're okay. As far as check the blood test showing up, you're okay. But by Oriental medicine way, we're saying, not okay. You are out of balance. That means in the future, very soon, you're going to have a cancer, you're going to have autoimmune disease, you're going to have a very bad kind of disease. This is the only one reason lung cancer is this kind of type is easily get cancer. So we have to be very careful to have a good balance. Having some good herb is very good. Now, I'm going to talking about the natural way. I'm telling you how to confronting cancer. We don't say we can cure cancer, no. But we are much better way to solve this matter by naturally make a symptom really get better, okay? So first of all, this is a Oriental method, but the natural way I say about you have to have a good diet, okay? What does it mean good diet? As far as I know, you have to get rid of all the meat kind and chicken, pork, and anything I want you to get off. And then have some more food contain antioxidant. What is antioxidant food? Fruit and vegetable. Okay, you're going to have a lot of juicing and fruit and vegetable, organic. It's very important. You have a cancer, okay? You gotta do the good diet. That's the number one. A lot of people, once you got cancer, you're gonna, hesitate it, or your relative and your, whatever they say about, or doctors say about the the chemotherapy, you have to do it. So then you might ask the doctor, what if if I do the chemotherapy, how long do I have to live? Nobody answer for that. But doctor only say about your life is the 3 or 4 stage, maybe 3 months, 6 months, less than 1 year. They can say that. But a lot of people survive, and then how they do? Good diet, okay? So, you have to be tonified deficiency. You are the out of antioxidant because of you having a bad lifestyle. Okay, no matter what reason, you didn't have a good balance for the nutrient. So get to tonify the good nutrient, okay, and get rid of a toxication. Okay, what is the toxication? You have a cancer patient, too much toxin, smell not good, and chemotherapy is okay, but chemo is one of the toxic. Okay, so I don't say you do or not. No, I can say that, but anything toxic to pour in your body, you have to be very concerned because of smoking, drinking, and processed food, junk food, and all meat kind of preservative processed food. That's all toxication. You cannot live with that kind of food, living healthy lifestyle, very bad, okay? So number 2, exercise, okay? What does it mean exercise? Having more sunlight, vitamin D producing, build up in your body. A little bit exercise, make a strong liver kidney function, increasing more immune system, okay? So you have to build a more good immune strength, okay? Immune build, okay? That's very important, okay? And number 3 is control for the stress. Stress is one of the bad things to low the increase the decrease for the immune system. And also when you have anger, stress, and worry too much, and then unkindness, collision producing, make a very bad influence to your body. You know that for that, okay? So even something come up to, even you get angry, don't get angry. Whenever you confronting, you say about I like that. Even somebody criticize to you, thank you, dear, you telling me good things. But inside the mind, you don't like it. Of course, I don't like it either. But just for don't worry about too much. Don't fight with them. Just don't get stressed out. Okay, be happy. Always happy. Even you eat right now the water you can take. I'm better than some other people who cannot take the water and by whatever the put the hole in here they producing. I'm better than more severe people. Always thinking more positive. That's very important. Okay, and then I recommend highly for the herbal medication to have a good balance. Then hopefully you're going to have a good answer. Okay, so if you have a cancer, please do like this, and then you might consider Oriental way of making good balance is also very important. And then acupuncture is one of the also good making the balance. Today I'm discussing about the lung cancer, and if you have any question, and please welcome to call. I gladly help for the consultation. Thank you so much. Have a nice, wonderful day. Thank you.
I had high blood pressure and cholesterol, and I had take Western medicine more than 10 years. And because I had a side effect of that, so I go to Dr. Kim, and after 1 year take medicine with him, my high blood pressure go down below 130, and my cholesterol below 180. And my Western doctor told me I don't have to take the cholesterol, but I can take the high blood pressure medicine, 20 milligram, to protect my heart in case I don't have a heart attack. So that's what I take both 20 milligram high blood pressure medicine and Dr. Kim medicine.
And also you had a problem for glaucoma. Could you tell me?
I had a glaucoma, and I see the doctor, and he treat me more than 2 years, and still my high blood pressure of my eye is still high. The pressure of the eye high at some point that the doctor tell me that I have to have a surgery. I go to see Dr. Kim after treatment, couple times, 3 times, and my stabilize my eye pressure now go down below 13. I don't have to have a surgery anymore.
So you are very happy.
Yeah, I'm very happy with treatment.
So now, as a Vietnam, could you tell the Vietnam people for your experience for the Vietnam language?
Okay, tôi có high blood pressure và cholesterol rất là cao, more than 200 on cholesterol and more than 140 for the high blood pressure. After treatment với Dr. Kim 1 year, my cholesterol go down below 200, and my Western doctor tell me I don't have to take cholesterol anymore. And my high blood pressure below 130.
Vietnam language is for the Vietnam people.
Áp suất của tôi bây giờ dưới 130, tôi không cần phải uống thuốc về áp suất nữa. Chỉ cần uống với cái đô rất là thấp để bảo vệ heart attack, đó là 20 mg thôi. Và bây giờ tôi vẫn lấy thuốc của Dr. Kim, không cần lấy thuốc của Western medicine nữa. Được, cảm ơn.
So did you tell the glaucoma too?
I have my
Tiếng Việt.
The Vietnam language.
Tôi bị bệnh mắt, áp suất cao ở mắt. Đi bác sĩ Mỹ 2 năm 3 năm nay nó không hết, nó tiếp tục cao từ 13 lên đến 20, và bác sĩ Mỹ nói tôi là có thể tôi phải đi mổ, nhưng mà sau khi đi khám bác sĩ với Dr. Kim thì nó nó xuống còn 13, thành thử ra nó không tôi.
Yeah, I've been having to be treated by a Western medicine doctor to take care of my high cholesterol problems and my high blood pressure problem. And I heard Dr. Kim that he's a very good doctor in what you call Eastern medicine and have very high level of understanding of human um, function of all organs. So I came to him. He explained to me how to treat with Eastern medicine to take care of the cause of the problem rather than the symptom of the problem. And he just by touching my wrist, and he can determine my problem. And he explained to me how he's going to treat that, and that helped a lot. I understand that I get the right doctor, and after 2 months of treatment from Dr. Kim, I feel very, very good. And for now, I don't take the Western medicine anymore.
So you're taking a 2 pill for the blood pressure pill. Now we don't take any Western medication. Today showing up 135, 92.
Yeah, that's
So
good.
this is amazing, isn't it?
Yeah.
Yeah. So I'm really happy for that, and you happy for that. By the way, for the Edge of Vietnam, could you tell the Vietnam language for the very much about the situation for that? Okay, a little bit louder for the language.
Tôi có bệnh cao huyết áp và bệnh nhiều có máu có trong mỡ có trong máu có mỡ, thành ra tôi nghĩ là nhiều người nói với tôi là nếu mà tiếp tục dùng thuốc của Western medicine thì sẽ có những cái side effect, chẳng hạn như sẽ bị ảnh hưởng tới gan. Thành ra tôi mới lên gặp bác sĩ Kim để họ nhờ bác sĩ trị liệu. Thì tôi rất là ngạc nhiên khi bác sĩ không cần phải thử máu, không cần phải thử thuốc tiểu, mà bác sĩ có thể nhận ra tôi bị bệnh high cholesterol. Và bác sĩ bảo để bác sĩ trị cho tôi. Thì sau khi uống thuốc và chăm cứu bác sĩ Kim một thời gian thì tôi khoảng 2 tháng thì tôi cảm thấy những cái triệu chứng mà hồi xưa tôi hay bị nhức đầu hoặc là đau ngực không còn nữa. Và bây giờ tôi ngưng hẳn thuốc của Western medicine để lấy hoàn toàn tin tưởng vào bác sĩ Kim để trị liệu cho tôi, không còn bị cái chứng cao mỡ máu nữa.
Yeah, for the blood pressure, first I got a stroke, so I been coma like 9 days. The 10 I wake up, and then I see you advertise on the TV, so I came here. I took your medication and acupuncture. I see the blood pressure come down to 120 over 60 something. So that's why I stay here with the doctor. And from that time until now, he always keep my blood pressure the same. So that's why I follow with you.
So you don't take the Western medicine, blood pressure showing up almost 115, 120.
Yeah, no.
Okay. Could you tell the Vietnam language what you have in?
Tôi bị cái tai biến mạch máu não. Tôi bị coma 9 ngày. Tới ngày thứ 10 tôi mới wake up. Bác sĩ cho tôi mỗi ngày uống 2 viên thuốc. Tôi gặp Dr. Kim, tôi trên TV, tôi đến đây tôi uống thuốc của ổng với Acupuncture, thì ổng giữ cho cái blood pressure của tôi 120 mấy trên 6 mấy, very good. Thành ra tôi keep go on with Dr. Kim.
Okay, so currently, and you have a lot of back pain, is really severe. Could you tell me what happened?
Yes, and a long time it happened to the kidney on the left, and Dr. Kim có cho tôi thuốc, tôi uống một ngày sau thì nó bớt dần, và tôi đi tiểu ra cái whatever in my kidney. So from there until now, it's getting better.
So the doctor say you had a CAT scan, but even that they didn't give any medication, but since you took my medication, you was really good. So could you tell me some situation, even Vietnam language?
Yes. Uh, I went to the doctor and they gave me an appointment until the 20th of May, and they told me go take the CAT scan. I go take the CAT scan, and they gave me another appointment on June 1st. And from that time until now, I haven't taken any medication from doctor, but I took the medication. I get better after a day, and from there on, I keep going every day. So now I got like almost like no more pain. So I don't know. So we wait to get the CAT scan. I give it to you, so you check for me what's going on with my
And
kidney.
could you tell me about Vietnam language? Your back pain, severe was back pain was better after took my herbs. Could you tell the Vietnam
Yes,
language?
tôi bị cái ảnh hưởng bên thận bên tay trái, thì tôi nói bác sĩ Kim cho tôi thuốc uống một ngày sau thì hết. Từ đó tới giờ tôi tiếp tục uống cái thuốc đó, trong khi tôi đi bác sĩ thường thì họ cho tôi appointment để chụp CAT scan cho tới ngày 1 tháng 6 thì cũng có appointment trở lại.
Okay, thank you.
Okay.